Most village clinics also have a pharmacy for Western medicines. But the medical advances in China cannot really be judged unless one recalls the wretched conditions of the peasants before the revolution. A century of exploitation by the Western powers and the invasion by Japan had brought the people to unimaginable suffering. Conditions of work, for those who had work, were often appalling. Rickshaw drivers had a working life expectancy of just 8 years. Uprooted by the war or driven by starvation, thousands of peasants flocked to the already overcrowded cities. For the millions who required medical attention, there were no doctors or hospitals or medicines. Even when floods brought widespread epidemics, the number who could be inoculated was small. A very remarkable American doctor, Dr. Haide, has been in China since long before the revolution. And he has ever since been closely associated with the Chinese in building up the new medical services. He was especially involved with a nationwide program that finally succeeded in eliminating all venereal disease in China. I recently had a talk with him in Peking.
When I first went to the northwestern part of China, that is the Shanxi, Gansu area, it was in a period of civil war yet, and I was supposed to be the famous doctor coming in to cure all the illnesses. At that time, even there weren't any medical services in the countryside at all. None at all. And in the Red Army were the only ones providing any rural services, medical services at all. And those army doctors were trained in their own medical schools. They had to do everything from delivering babies to treating wounded, and with very, very little equipment. All our doctors were trained at a maximum of 8 months, and they served throughout the whole Civil War, the whole War of Liberation, with not more than a dozen actually qualified medical personnel. But the biggest problem was that the people were so undernourished, so tired, so worn out, that no matter what you did for them medically, you had to solve the problem of feeding them, really.
At that point, I asked Dr. Ma what happened after the revolution. The new government was faced with the need to do something for many hundreds of millions of people who had no organized medical services at all. How did they begin to tackle the problem?
Well, the first thing they did was they sat down and decided that they were going to provide medical services for all these people.
They did?
Yeah.
That was the basic decision?
That's the basic decision. Once they decided that, they had to get on with the job. I think the real leaps where you noted qualitative changes in the medical services, the earliest one came at the beginning, of course, when they decided that they're going to treat all the people and provide a health service for everybody. But the second period came during the Korean War. And there was inaugurated at that time one of the famous mass movements, the patriotic health movement, getting rid of the 4 pests, hygiene among
What were the 4 pests?
There was flies, mosquitoes, rats, and sparrows. But we relieved the sparrows, we re-liberated them. They weren't as culpable as they should have been, were thought to be. And we substituted bedbugs.
Ah.
But, and then there was a whole educational movement on hygiene, both personal and environmental hygiene, control of water, supplies, wells, feces control, fertilizer, composting, and personal habits. You had to change the whole concept of a people's hygienic mentality. After being so subjected to superstition and lack of knowledge of where diseases came from. Well, I think that period laid a very strong foundation so that this habit took hold, and at many times during the year now, at holidays, spring festivals, all there's big house cleaning, general environmental cleanup and so forth. The second period, I think, was during the Great Leap Forward.
What happened there?
The Great Leap Forward contributed mostly in medicine to a number of things. One of the major things it did was highly organize the rural population so that on the one hand they could be helped, on the other hand they could help themselves. Instead of dealing with an individual family or a cooperative of 50 people, here you had a commune of 20,000, 30,000, or 50,000, and you could approach them as a unit, as a collective. So if you had any preventive work you wanted done, or vaccinations done, or treatment of any of the chronic diseases done, it was very simple to handle them as a unit. And that's where most of the eradication of diseases really climaxed into a dramatic result. For example, it was already by that time that we'd got rid of smallpox, cholera, plague, venereal disease, Kala-Azar. To eliminate venereal diseases is like one of the prime things to do is to change the social system. You have to cut out the economic roots of prostitution. You have to raise the living standards of the people. You have to educate them. In China, they were more at a disadvantage because you had the whole feudal oppression of women. But when women are sold into prostitutions from early childhood and people making money and profit out of this, and the morals of a society degenerating around a money nexus, you're not going to be able to eradicate this.
Nope.
With the youth growing up and having a new ideals and new moral incentives and commitments and so forth, women being liberated, marriage laws taking effect, the economic equality of women being recognized and worked out, the roots were cut out again and the people were very cooperative. We treated them with regular antibiotics, penicillin, and the other treatments. That was quite simple. The technical parts are quite simple.
The other tremendous problem in China, surely, was drugs, opium. What is the situation in regard to opium today?
Well, it was a terrible problem to start with. And by the time of liberation, this problem was much more extensive because the armies back and forth, Japanese penetration throughout the country. But at the beginning, after liberation, one of the first things that was done was to stop opium growing completely. And then we set up medical clinics for treatment. And fortunately, opium was much easier to handle. Opium addiction was easier to handle. We used, one of the very cheap methods was just using magnesium sulfate solutions, 25% in injections. That would give a relaxation of the muscles and help tide over part of the thing, and extremely cheap. And feasible, acceptable to the addicts, and easily delivered by the medical personnel or paramedical personnel.
Dr. Ma told me that the Cultural Revolution gave a big impetus to the medical profession.